bedside.
Good morning, listeners, and welcome back to Beyond the Bedside. I'm your host, Brooke Levin, accompanied by Katie, Mara, and Charlee. We're so excited to be back with you all. We hope you had a great week. Today we'll be discussing telehealth and debating the pros and cons of telehealth. Before the girls dive into debate mode, let's talk about the basics. What is telehealth? According to the Human Resources and Services Administration, telehealth is defined as the use of electronic information and telecommunication technologies to support long-distance clinical health care, patient and professional health-related education, health administration, and public health. Now, what kinds of technology can be used for telehealth? Basically anything you can think of, right? Internet, video chat, image messaging, video streaming, wireless communications, telephone calls, data and health information tracking, and then secure lines for messaging with providers. As we've all seen and experienced through the COVID-19 pandemic, telehealth has greatly expanded in current years. Some say this has led to improvement in coordination of care across the continuum, while others disagree. Let's see what Katie and Mara have to say about this.
Welcome back to the debate segment of our podcast we lovingly call Two Sides of the Chart. Today, I'll be covering the benefits of telehealth.
And I'll be sharing some of the challenges and concerns that come with telehealth. We'll go ahead and jump right into it.
One of the biggest advantages of telehealth is convenience. Patients can connect with healthcare providers from home, and eliminating travel time and reducing costs associated with transportation, childcare, and taking off work.
While convenience is definitely a benefit, telehealth also has some limitations. One major concern is that providers can't perform a comprehensive exam through the screen. This can make it hard to identify certain health conditions and assess symptoms accurately and fully.
That's true. However, telehealth is shown to improve patient satisfaction because many patients appreciate efficiency, communication, privacy, and comfort it offers. For routine follow-ups and minor health concerns, virtual visits can be a great option.
While some patients may find using technology convenient, others may see it as a challenge. Not all patients have reliable internet access, appropriate devices, or the skills needed to navigate the telehealth platforms. Technical difficulties can also interrupt visits and create barriers to care.
Absolutely. And that's something healthcare organizations need to consider. But overall, I think the benefits often outweigh the drawbacks. Telehealth is especially valuable for patients with chronic health conditions. Remote patient monitoring allows providers to keep track of important health data in between visits, which can lead to earlier interventions, potentially reducing hospitalizations and healthcare costs.
While remote monitoring is helpful, it raises concerns about the accuracy of patient-generated data. If information is incomplete or inaccurate, providers may make recommendations based on the data that doesn't fully reflect the patient's condition.
Yeah, well, another strength of telehealth is its broad application. Many specialties from primary care and mental health to dermatology and chronic disease management can successfully use telehealth to provide quality care.
And while telehealth continues to grow, there are still some concerns surrounding privacy, security breaches, and regulatory barriers. Healthcare organizations have to protect sensitive patient information, and differences in regulations across states can make telehealth services more complicated. There are also ongoing questions about malpractice liability when care is delivered virtually.
Overall, telehealth has expanded access to healthcare, improved convenience, and provided new ways to monitor and manage patient health.
And while it offers many benefits, healthcare providers must carefully consider its limitations to ensure patients receive safe, effective, and comprehensive care.
Thanks for joining us on this discussion on telehealth.
We hope this has been a beneficial conversation for you.
Now that we're done with our debate aspect, I'm going to move it over to Charlee so she can actually share her own experience with telehealth. Charlee, what do you have to say?
All right, so ladies, that was really good. You guys pointed out some really good, bad pros and cons.
Thanks.
So I personally worked as a medical assistant for like 3 years, and so I kind of got behind the curtain view of like how these telehealth appointments worked as a medical assistant and from like the physician's point of view. So when it comes to that, doctors are usually still seeing patients in clinic, right? In person, and then they have a telehealth scheduled in the middle of the day. So sometimes your doctors are late to your telehealth appointment. I have had patients call in where they have been waiting longer than 40 minutes for their doctors to get on. So that can kind of be a bad side effect of it because you don't have that communication. You're logged on to Zoom and you're waiting for the physician to come on. You don't know what's going on because the doctor is not on there yet. So for me personally, I worked for a hospital that used Epic. I'm sure most of us are pretty familiar with that service. And my chart is an Epic system. And so most people that see their doctors through there, they go through my chart. It takes you into Zoom. And it feels more safe and secure, I've noticed. When you log in, you usually have a medical assistant hop on before the doctor or the nurse practitioner comes on. And they kind of verify your name and date of birth. They are asking what's going on, symptoms, any medication changes. They're kind of going through everything, and it's thorough. And that MA is allowed to go over to the doctor and say, hey, this is what's going on with this patient, this is what they want to talk about, and so that doctor comes in prepared. Something I've noticed though with some of these newer telehealth platforms like Amazon Medical, because yes, now you can see a doctor through Amazon Prime,
Crazy.
is that it doesn't seem very thorough. You can get on Amazon Prime, sign into an Amazon Medical platform, and you can just message with AI and say, hey, this is what's going on with me.
Wow.
And they might not ask very thorough questions. You're texting with AI saying, hey, I'm having back pain, this is what's going on with me, or maybe I got a cold sore, I'm feeling sick, my nose is running. And you might not speak to an actual provider at all. You might just text with AI the whole time. And then that AI doctor is going to prescribe you medication. And yes, that prescription has to get approved by a practitioner or a physician to get it sent out, but you're never speaking to that doctor. While that can be very convenient in tight situations, and I'm sure we have already come across situations being in this program where we don't have time to go to the doctor, and we really just want something where I can just text someone and be like, can you please refill my meds? I don't have time to be seen. And it's very convenient. But what happens to people that have no medical background? And something that always gets in my head is what happens if they get prescribed a medication that has a contradiction with another prescribed meds, and that was not clarified on these AI specialty doctor visit appointments. And I'm sure we have seen a lot of ads, I personally have, for weight loss meds going through apps, and so you don't really, they say you're guided by a doctor, but if you really try to go through that, you just have a doctor that's writing the script for you. You really don't speak to them typically. And so it's very easy for people to lie or not give the full truth, or unknowingly not tell the full truth because they forget. My blood pressure's been managed, but it's because I take a blood pressure pill every single day. I got sick, I got just prescribed a decongestant like pseudoephedrine. Well, that can be a contradiction to your high blood pressure. It's really scary. But overall, I think that being a patient in a busy world, being a busy student, or even for older population, being able to sit down and connect with your provider very quickly, and it just takes 15 minutes of your time, can be very convenient. I just think that as people that need healthcare via telehealth, we need to be aware of the cons.
I think that speaks to both Mara and I's conversation, the pros of being convenient, but it definitely needs more regulation.
For sure. Ladies, you've given us all some stuff to think about this week when it goes to telehealth. As we can see, there's definitely some pros and cons to both sides of telehealth. I'd say it's definitely a great resource, but make sure that your needs are being met, right? Be your own advocate when you're out there in telehealth resources. Thank you all for tuning in, though. We look forward to talking with everybody again on next week's segment.
Be on the bedside, be on the chart.